morning, family. My name is Mel Wells, and I'm so grateful to be with you today. Another Motivational Friday, but today I have a special guest, one of my good friends, a brother of mine, Dr. Scott Metcalf. He's joining me today, and what we want to do for a moment is just take a pause and let you hear some of his background. And if you haven't heard of him before, you better check out the TV show, the reality TV show, Married to Medicine. And I also have my partner here, my boss lady here with me, Tasha Wells. Tasha, if you can read the bio.
Yes, today, so we have here W. Scott Metcalf. Walter Scott Metcalf, MD, is an American physician and business owner, best known for the appearances on Bravo TV, Married to Medicine series. Guest on HLN, Headline News, providing expert opinion on world health issues, guest speaker and lecturer on radio, and highly featured on numerous podcasts. His involvement in published research as an undergraduate at Michigan State University.
Michigan.
Yes, has contributed to current research in prostate cancer treatment.
Wow.
Yeah. Dr. Metcalf is a graduate of Michigan State University with a BA in biological science, medical doctorate from Wayne State University, and is a board certified family physician. His growing popularity has Dr. Metcalf being sought out for professional expert opinion on world health issues, lifestyle, medicine lectures, physical health, and preventive medicine.
Wow. Welcome. Good morning, Doc. How are you feeling
today? I'm good, brother. Thank you. And thank you guys for having me, Mel. I appreciate it. And just want to thank ODAT for doing what you guys do for the community. And I'm very excited today because I think we got a lot to share, and I think this is going to be very beneficial for our community.
Yeah, I'm looking for a lot of help for the community and also for myself. But before we jump into it, tell us a little bit about the show, the reality TV show, where does it air at? I know people are going to want to come on. They're going to want to see what's going on. Tell us a little bit about the network, your wife. I read up on your wife. Your wife was making a lot of great comments about you. Tell us a little bit.
Well, my wife and I have been married for 16 years now. We have 3 beautiful children. We have Lauren, she's 12, Landon, he's 10, and Layla, who's the powerhouse of the family, she's 7.
Wow.
We kind of stumbled on reality TV because we're both physicians and we're entrepreneurial. So we started a few businesses. We dibbled and dabbled in real estate, and I guess that kind of got our name and got a buzz going on. So we were kind of sought after by a few reality TV shows in Atlanta that I won't name, but we ended up joining Married to Medicine because we thought it would be a good fit. Because one, we are physicians, and we did see that the show, it is a conflict TV show. So don't get me wrong, because it is a reality TV show. But at least it has some physicians on there, and it's showing some forms of Black excellence that you don't see on other platforms from my experience. And that kind of convinced me to tell my wife, like, yeah, let's give it a try and see where it takes us from here.
Yeah, I was even reading up on just the family background. It seemed like I bumped into something like your wife was, she can, drive a plane. She can fly a plane.
Man, that woman right there is she's when you say diverse, like I thought I was diverse being family medicine. I delivered babies, I do minor surgeries, I do procedures, cosmetics, Botox, weight loss, and primary care, and most of all preventative medicine. But this woman she joined the Navy.
Yeah.
She became a flight surgeon.
Right.
So there's probably like less than a handful of Black female flight surgeons in the United States. She was intern of the year for the Navy. So that's not just one program. That was for the whole United States in Bethesda, Maryland.
Come on.
Yeah. And with her training, she became a flight surgeon. So that's a specialty medicine for the military. And it's awesome what she does. So she would travel with the Marines when the Marines went out on debts, when she would be the physician that took care of the pilots. She would tell the pilot whether they can fly, whether they're grounded, perform flight physicals. If there's a military crash, they would have to fly her to the scene to investigate the crash. So very interesting. And then in the interim, of the training, she had to do the survival training, getting dumped out of a syndicated helicopter, swimming 50 feet underwater, and then learning how to fly a plane.
Wow.
I feel so bad, bro. I'm so weak. I'm so weak compared to her.
Look, I say the same thing, man. I'm not gonna try. I'm not gonna.
Hey, but what I saw about you, Doc, what highlighted wasn't the stuff in the show, wasn't the drama in the show. You never left your post as a dad.
That's right.
That's your number one title for real is dad. And I wanted to highlight that, we have a lot of men, a lot of single women that are at homes now, but you lead by example, showing how to be a good man, a good dad. I would say even a godly man as well as a doctor, but also heard your wife make some good comments on you on Instagram. She said, I thank the Lord for my husband. And anytime you got a wife thanking the Lord for you, that's an awesome thing. And today, when I just, let's jump into it. I need help, Doc. I need help for my community. We're not listening. People have myths, they have gossip going on. And I have some of my staff here, my coworkers with me today. They more the experts that working on the front line, saving lives, overdose reversals, trying to get people the vaccine, trying to just make sure people get tested. But the reason why I'm really calling on you today was that if you see in my hand today, I have in my hand, and this is just my icebreaker that I went through last night. You probably like, what is this, right?
Okay.
My mom passed away from COVID-19.
Oh, wow.
This is her death certificate.
I'm so sorry to hear that.
Last night was the first time I got to go in my mom's pocketbook, because in the hospital, they put it in plastic bags and all that stuff like that. And I want people to listen so they don't have to have their mom come home in this type of bag.
Wow.
They belongings. And I'm begging on you. I'm holding back a little bit. I don't want nobody suffering like I suffer. I don't want nobody, mom, kid. I even had a staff member who passed away. And just alone on my block, my mom had at least 2 of her girlfriends who also passed away from COVID-19. So community, we're here today with the doc to ask for help, to help you, to get rid of the myths, to get rid of the rumors. And I want to just jump into some of the most important questions that my staff do have. And I really pray that the community is listening. And listen again, y'all, you got to reach out to Dr. Scott. They're on Instagram. You can see him on Bravo TV. This is just our people. Yeah, I know you're a doctor, his wife a doctor, but this is our guy. And we can believe in what he's saying. I want to talk about that today. And I want to start with the head of our case management department, Ebony Gardner. Ebony, good morning.
Hi, good morning, everyone. Thank you, Dr. Metcalf, and thank you, audience, for joining us today. Again, my name is Ebony Gardner, and I'm clinical director for One Day at a Time. I've been with the agency for 7 years. And as a social worker in the field, I'll just jump right in, Dr. Metcalf, to the question. I've been engaged by people who are interested in understanding how it is that a vaccination can be quickly developed. Yet for issues like cancer, we have yet to find a cure or a drug that can, quote, prevent or cure HIV.
That's a wonderful question, Ebony. And I'm glad you started out with that, because we're going to start off by dispelling some myths. Okay, because when we talk about COVID-19 virus being fast-tracked, that is true. It has been fast-tracked. But the technology used to develop the COVID-19 viruses is not fast-tracked. That technology has been around here for years. And if you think about a perfect example of two mRNA viruses that have already been out, one would be the Zika virus. Remember, the Zika virus was pretty heavy and affecting people all around the world, and they thought that was going to be a really bad pandemic. But they developed the vaccination for the Zika virus, which is an mRNA vaccination, which is the same as the COVID-19 vaccination. So the technology has been there, and just as we all know, technology is advancing. So 20 years ago, if I wanted to call you, if I wanted to call Mel on the phone 20 years ago, I had to wait till I get home. I would have to wait till I get to a payphone, and then hopefully he'll be home. And if I call Mel, he wouldn't be there, and I'd have to wait till we catch up, right? But now I got a cell phone. I can call Mel, and Mel has that right there on his hip. So boom, right now we don't have to wait. So that's that gap in communication that's diminished. And that's what all technology advances. And the same thing with science. So everything is advancing. Now, as far as the HIV, let's talk about HIV. No, there is not a vaccine for HIV. HIV is a viral infection. We know that it's an RNA, but HIV gets into your body, it converts into DNA, and HIV is an infection. So when you think about that, what's going on with HIV now? My patients with HIV are doing excellent because of advances in science and technology. The antiviral drugs, the protease inhibitors, they are excellent. You don't hear too many people dying of complications related to HIV now. HIV is an infection. AIDS is a disease. So the rate of AIDS has decreased dramatically with the advances in technology. So people can't say, oh, they don't have a cure for HIV. Hey, HIV, we have people living with HIV normal lives every day. And everybody, we know we have perfect examples in the community. And our favorite may be Magic Johnson, who told us back in 91 that he was gonna beat this thing, and he did. And that's what the advances in technology and medicine. It's a wonderful thing. So HIV is nearly, it isn't preventable. We know how to prevent it. It's precaution, it's preventative medicine, is limiting your exposure, is wearing condoms, and it's not using IVD drugs. So we know how to prevent HIV. We know the preventative measures that we can take with that. So let's move on to another thing, besides saying that we don't have a cure for that. And then think about leukemia. Let's just say childhood leukemia, ALL, that the bad leukemia. 30 years ago, the death rate from leukemia was 80%. Now it's less than 20% due to treatment, advances in technology. And so we can't say cancer. I mean, nothing's 100% curable, but think about it. 80 out of 100 kids died from cancer with leukemia back in the 70s. And now you have less than 20 out of 100 that may pass. So I think we're doing pretty well on the medical aspect of advancing technology. And that Intel will say that's why the fast track for the mRNA virus for the COVID-19 has been,
So before we go on to the next person, family here, Ebony is one of the leaders in the city. Why do I say one of the leaders in the city? And thank you, Ebony, for your comments, because your team goes out every day and you have the #1 team that find the most positive people living with the virus. And we would like to thank you for what you do. Thanks, Dr. Med, for giving that information to Ebony. What I want to do now is move over to YRM, youth recovery mode in the house. Brianna is spectacular. She has adopted all the kids in the neighborhood. When I walk in the office, they calling me to go. Uncle Mel. Brianna, welcome.
They're calling Mel the goat, and apparently I'm the old head now.
I'm cool with that. Let you keep that, I keep the goat.
Good morning, Dr. Scott. Thank you so much for sharing your time with us.
Morning.
My question for you is, what are some things you and your family have been doing over the last year throughout the pandemic to really stay positive and stay connected to, the outside world?
Well, seeing that we're in the pandemic, and the most important things we need to do to stop spreading this pandemic is to socially distance ourselves and to to wear a mask in public. My family itself has been, we've tried to grow closer, and that doesn't mean coming home. Because I noticed initially during the pandemic that our computer time just vamped up. My kids just wanted to be on the computer. They wanted to play games on the computer. And I said, man, we're all home and we're not spending time with one another. So right then I said, we got to scratch this. We got to set the limit to the amount of exposure that they get to the internet and television. And we got to set up some family time. So that included, my kids know how to play board games. They know how to play card games. We've adapted doing puzzles. We'll sit there and do a weekend puzzle before we do any board games. My youngest is 7, so she's the bingo caller. So we play bingo here at the table for dinner. So we have, we begin to enjoy ourselves and enjoy our home. A lot of people, you work so hard to get a nice things, nice home, and you really don't enjoy it because you're working a lot. So sitting back now is like almost at a time God tells you, you know what, I'm gonna make you sit down and relax. My wife is the busiest person on earth, and she won't tell anyone no, this has caused her to kind of sit back and relax and regroup a bit when she was able to come home. In the height of the pandemic, she was working in Tennessee at the VA hospital doing screening and employee screening for the VA. And when she came home, it was more time to let's digress, let's relax, let's get to try to know each other a little bit better. My kids, I've been doing everything. I've even done the Joe Jackson. I bought studio equipment. I got kids singing. I got kids taking piano lessons every Saturday and Sunday. So, you know, I'm gonna make sure that something good comes out of this pandemic for us. But most of all, it's just family time, and the main thing is checking on one another. My family's my entire family. We do weekly. Because with my mother's side and father's side, we do bi-weekly Zooms in which we all get together and we do crazy things. We do fashion shows, we do talent shows, we do board games, we do Q&A. So we play Pictionary on Zoom. So we have a good time. So it's just really getting to know each other and just getting out there and enjoying life and enjoying your family.
Brianna, thank you so much, you know, for the question that you asked. And Doc, we appreciate you guys chiming in on how to have fun while in the home. You know, next I want to bring on, I call him the professor of one day at a time. But bro, Chris, he leads all our shelter teams. He has the staff up under him. Bro, you didn't know I was going to say this, but I want to highlight him, Doc, because this guy is actually used Narcan. Last time I had it, Chris, I think it was 12 people that you had to reverse from overdoses. Wow. I'm sure that number went up. And one day I seen you running down the street like you was the police because somebody actually overdosed on the street and was ready to open up a site. So I, you know, welcome this morning, no other than Christopher Deans. What's up, Chris? Good morning.
Doc, good morning. Thank you so much for your time and thank you so much for doing this. Just a little tidbit, like I appreciate the ability, just your show, you know what I'm saying? Your show, I think in our community, representation matters, right? And it's important that, you know, our community can see individuals like you and your wife and just all the amazing things that you guys are doing that look like us, right? So it could be like, I can do that too, right? So I just want to thank you for opening up your heart, your home, you know, for cameras to cover that.
Thank you.
You know, no problem. My question is simple, right? Like, so I'll share this. I was, unfortunately, I was COVID positive. I tested positive in October, and you know, I actually had to be hospitalized with the virus, and you know, it was a horrifying experience, you know, and to a lot of my community, right? I'm trying to educate them on the vaccine. You know what I'm saying? Like, you know, why the vaccine is important. In my case, I got caught slipping. You know what I'm saying? I knew I should have a mask on at all the times, but I ran group. You know, group is really, really special to me for a lot of our participants here. And, you know, I was running group without a mask. And from that experience, you know, led to me testing positive, you know, from the virus. So with that being said, like, as simple as put, like, why is it important to consider taking the vaccine? Why is this important for our community? And why is it important to take it?
Okay, Chris, why is it important for us to take the vaccine? Because we're in a pandemic, a global pandemic. Okay, we want to limit the spread of COVID-19. This coronavirus, this variant, this is SARS-CoV-2. So the variant that's causing this is called SARS-CoV-2 because it's a variant that causes severe acute respiratory distress. This is what's causing the pneumonia and deaths. And we hear people in the community saying, okay, well, I mean, it's 99% of the people who get it, they'll be fine. What about the other 1%? If we're talking about numbers, you know, what about the other 1%? So just, I mean, even if it's 99.9%, you know, that's just saying one person out of 1,000 dies. That's a lot of people. And let's put it in perspective, out of this 99%. Okay, typically in the US, the leading cause of this deaths is heart disease. 650,000 people die every year of heart disease, right? 600,000 people a year die from cancer. Lung disease, 160,000. Stroke, 150,000. Alzheimer's or dementia, you got around 120,000. Diabetes kills about 90,000 people per year. Pneumonia and flu. So the typical flu, you remember when people say COVID is nothing but just the same as the flu. It's not even as bad as the flu. Well, the flu and pneumonia combined only kills about 50 to 60,000 people per year. We have over 400,000 deaths due to this one thing, COVID. So COVID is the #3 leading cause of death in the United States right now. Okay, and that wasn't even on the list in 2019. It's on the list in 2020, in 2020. that right there will tell us that we need to do something about it. If something in less than 1 year has become the third leading cause of death in the United States, more than automobile accidents, then we know that we are in a pandemic. We need to do something. And us 99% of people who are healthy, guess what? You may have a child that's not healthy. You may have a child that may have an underlying asthmatic disease that hasn't been determined yet. Because in children, the most common presentation of asthma in children is like a dry cough or a chronic cough at night. It isn't wheezing, it isn't having severe shortness of breath. It's just a dry cough 2 times a week. And that's how we adjust it as physicians. It's twice a week, a child has a cough, that may be cough-bearing asthma. So we're doing this for the children. We're doing this for our siblings. We're doing this for mostly our parents, our aunts, our grandmothers. We have extended families. And that's the beautiful thing about our Black community is we've been blessed to have extended families. A lot of us are blessed to still have a grandmother in the home or a grandmother that we visit or have dinner with on weekends. We're doing this for them. We're not doing this for us. If you feel like I'm healthy, I don't need this vaccine, okay, it's bigger than you. It's bigger than me. So just say, if I go out and I can get this vaccine and prevent it from spreading to 10 other people, why not get the vaccine?
And Doc, I just want to ask the question of, I heard something on TV, they said it took more people than 9/11. They said this is bigger than 9/11.
Right.
So
9/11.
Go ahead.
Yeah, I mean, what was 9/11? 1,400 people? I mean, you got a disease that's killing over 3,000 people a day.
Yeah.
And we hit a high. We hit a high this January. December, we thought we were at the highest peak. We were 77,000 deaths in the United States in December. Already in January, we're at 79,000.
Wow.
Yeah. I believe I lost my mom right before the January came in.
November 30th.
November the 30th, I got a call at 6:36 and said, well, your mom is gone from COVID-19. And we are one of the leading organizations trying to fight COVID, trying to wear a mask and everything. And they were saying, well, it took more people's lives in World War I, 9/11 combined. And I think even said World War II, Jennifer. And me saying and talking about 9/11, I called Jennifer, my fire department. She comes in and put all the fires out. This lady right here, I'm so grateful to have her on my team. She works for me, but in some weird way, she is also my coach, my sister, and my wife also allowed her to be my work wife, so she gets to tell me off as well. But Jennifer, we thank you for what you do. And we just want you to ask your questions that you've been asking the city. Doc, she fights the city, she fights the mayor, she fights the government, whatever it takes to take care of her people. And I introduce no other than my sister, Jennifer.
It's an honor and privilege to talk to you, Dr. Metcalf, and as an extension to your wife. I am an advocate for women of color, and I am very, very grateful, like Chris, to see you and your wife every day on TV representing us, but most of all, representing those who will come behind us, who get to see you, and you represent us in that way. And I'm very grateful and honored. So I'll ask my question, which is, my greatest concern is for the youth who are so hesitant to take the vaccine. And how is the healthcare system dealing with the young folks of color, especially in their resistance and mistrust of the field at large? But moreover, the provisionally approved vaccines, regardless of the documented efficacy. And I say that because my daughter and I and my husband, we literally, we're that family, right? I said, I'm going to bring you data, you bring me data. We're going to talk this out until we come to a conclusion. But she's 18, she gets a choice. And so, but she had to plead her case with us. She had to show us why and why not, and show that data. I think we won the fight, I think. But I just know that I'm fortunate to have a kid who is going to do her homework and make sure. But there's so much mistrust. There's so much misunderstanding. What is the medical field's, kind of answer to them?
Well, I mean, I think it's wonderful that we have, when we think about our youth right now, they're leading the whole Black Lives Matter. They're leading this whole civil rights era. And so we have to applaud our youth because they're not just sitting down and accepting everything as is. They're questioning everything. They're challenging authority, and all these things are great. And when it comes to COVID-19, we have to do just like we said we need to do, Ebony, and that is to educate them. We have to educate them, and we have to show ourselves as being examples. And so I think just as we want to be examples of a good parent, a good citizen, we have to be good examples to our children. So kids not want to have the vaccination and their doubt being questioned, the main thing we have to do is educate them. You know, we have to educate the kids. We just need to dispel the myths. We need to dispel the myths. There is not a specific load of COVID-19 vaccinations going to the Black community. There are no labels on these vials. And the first people to get the vaccination as recommended by the CDC are healthcare workers and elderly and people that are vulnerable to succumb to the disease. So I don't think the government is going to kill off their doctors and their healthcare professionals first, because we're the first ones to be offered the vaccination. So we can dispel that myth that this vaccination is a target for anybody, an individual. You know, it's not a genocide project. We can dispel that myth because the first people getting this vaccination are doctors, healthcare workers, nurses, and people that are on the front lines and the most vulnerable to COVID-19.
Yeah, I see Ebony's really excited about that. That's what she's been telling everybody. Look, this is what you got to listen to. And just on this call alone, on this FaceTime alone, raise your hand if you have received the vaccine. Raise your hand. The reason why we do that here is to show to our community that it is safe, that you will live. You ain't going to die or anything. But it's very important for us to step up and watch each other back. I wish this vaccine was here before my mom passed away. And I don't want that to happen to nobody out there. And that's why we begging you, and I'm not embarrassed to beg you, community, to please listen. You can put comments up here. We can get them back to the doc. We can get people to answer your questions. But the most important thing we got to do is listen to one another. You know, study what's going on. And I just wanted to make sure that we come here today to the community. I wanted to dedicate this show, of course, to my mom, but also to my staff member, Dennis Todd, who worked at Kensington in Love Park. He worked during the COVID season, during this season of COVID. I believe, Chris, we just lost him maybe a week or two ago, and we just had a candlelight. So this thing is real. It is here. Listen up. You see, we got Dr. Metcalf here with us. He's even pleading you. He's not here in the city of Philadelphia, but he called me and said, no, I got to talk to the city of Philadelphia. I got to talk to my people in the community. He didn't say, like, I want to talk to the doctors. I want to talk to the rich people. I want to talk to our people. And that's what we brought here to you today. Dr. Metcalf, before we get out of here, is there a message of hope or something that you can give to our people in the community, give to us so we can be your ambassadors to go and change our community and what's going on?
We can look and see at different communities in the world that have tackled this pandemic with vigor. You know, they've been stringent on wearing masks, they've been stringent on social isolation, and these communities, whether it be overseas in Europe, and they have shown that they can decrease the prevalence of this pandemic and decrease the death rates. And so we have to do the same thing. We have to be stringent on wearing these masks, social distancing. You know, we can all, we don't need to go out. We don't need to hang out. We don't need to party. I mean, we can all sacrifice a few weeks of our life in order for the betterment of our people and our family. Our main thing is that we need to love one another and show that we love one another. And that is by social distancing. That is by wearing our masks. It is by keep staying healthy, getting on your vitamins. You know, there's about 4 daily vitamins that you need to take to help prevent any complications with COVID-19. We can discuss that, and they're on my page, my wife's page, and that's it. Really, it's just educating one another and just being there for one another during this time of pandemic, because we know. I want to really quickly address that. We have in the U.S. about 50,000 suicides per year, right? And studies are already showing that depression is up 28% amongst Blacks and Hispanics, 28%. And you know, depression is always underreported. It's never reported accurate numbers, so that those numbers could be higher. Substance abuse amongst our youth and adults, up 20%.
Yeah.
Due to this pandemic. suicidal thoughts and ideation with mental health screening is up about 8 to 9%. That's a large percentage. And then remember that we are in a pandemic, so a lot of our patients, our mental health patients, they have lack of access to healthcare. If they had lack of access before, they really have lack of access now. And we that's why we have to be stringent. We need to fight this together. You know, vaccinations. You know, polio used to kill how many people per year? And polio was eradicated from 1960 all the way to 2010, when a small community in New York decided to stop vaccinating. We got to think about it. That vaccine worked. You know, how many people did you hear dying of polio? You know, and the same thing. We want to say the same thing. That this vaccination worked. How many people are dying from COVID-19 now? That's what we want. That's what we want to be able to say in the future. So, social distancing, everyone getting, as many people getting vaccinated, and they're talking about the herd immunity, because if everybody has it, especially us that live in these close-knit communities, herd immunities, these close-knit communities, if we all get immunized against it, then we have less chance of it spreading and killing our loved ones.
Yeah. Thank you so much, Doc. And we're going to try to get you back. I'm going to talk to Jennifer. Jennifer, you're going to get me some money so we can bring Doc back on and talk to a larger audience. Maybe I can do something with the city of Philadelphia and City Hall so you can talk to the whole entire city. We have 200 clients and bids, and I always say I don't really use my title as the president, but as the servant. And I just want to thank you for coming here today, but we also like to bring you on a platform where you can talk to all of our clients so they can feel more safe about it. All right, I just want to stop for a moment before we end the show as a moment of silence. Why? Because somebody's getting ready to go into the hospital and get put on a ventilator. Somebody's getting ready to get put in a body bag. Somebody's coming down with COVID or contacting COVID, and don't even know that they're coming in contact with COVID. Moment of silence for our people, and not just African Americans, but around the world. Moment of silence. Family members, thank you so much. It's most importantly, thank you, Dr. Metcalf, for coming here today. We look forward to partnering with you. Me and my wife will be reaching out to you and your wife. I also just want to thank Ebony for coming here, Brianna, Chris, and Jen, and also my boss lady for being here and sitting with me by my side, being my strength. But also the most important piece we want our family members to know, please wear your mask and make sure that whatever you do, wash your hands and continue to practice social distance. My name is Mel Wells, and you have just bear witness Motivational Friday. Peace and blessings, and stay safe. Thanks, Doc.